Hi, welcome to Medicoria. Please like, comment, subscribe, turn on the notifications, and share with all that might benefit. We're going to look at an overview of hepatocellular carcinoma, also known as HCC, and also discuss the findings on ultrasonography. HCC is a primary malignancy of the liver. It is the third most common cancer globally. It is the second most common cause of liver cancer, the first being metastasis. Its incidence is on the increase globally, especially over the past 2 decades, and the incidence is still expected to increase over the next decades. What are some of the risk factors for developing HCC? HCC is associated with chronic liver disease and cirrhosis. 80% of patients with HCC also have liver cirrhosis. The following are the conditions associated with liver cirrhosis and chronic liver disease. Chronic infection with hepatitis C virus. 30% of the cases of HCC in the US can be linked to HCV infection. Chronic hepatitis B virus infection. 20% of the cases of HCC in the US can be linked to HBV infection. In sub-Saharan Africa, HBV infection is more common than HCV infection. 30% of the cases in the US can be linked to alcoholism. The other risk factor is non-alcoholic fatty liver disease and non-alcoholic steatohepatitis. Also hematochromatosis and aflatoxins. Aflatoxins result from contamination of food by fungi. However, 25% of the patients with HCC do not have any identifiable risk factor. The case I present today is a 50-year-old male who presented with a 1-month history of painless abdominal distension, nausea, decreased appetite, unintentional weight loss, and headache. The general examination findings were unremarkable, except for a cachectic appearance. On per-abdominal examination, his abdomen was mildly distended, the collateral veins were visible, he had about 3 hyperpigmented patches, each measuring about 5 cm in the widest diameter. He had hepatosplenomegaly. There was an obvious mass in the epigastric region. It was nodular and tender and dull to percussion, and it was continuous with the liver. In early stages, HCC may be asymptomatic. In the later stages, the patient may present with right upper quadrant pain, unintended weight loss, signs of decompensated liver disease, for example, jaundice, pruritus, hypoalbuminemia, clotting disorders, among others. The patient may also present with features of portal hypertension, for example, gross ascites, splenomegaly, hemorrhoids, esophageal varices, among others. There may also be features of distant metastasis depending on the organ involved. Here are some of the ultrasound images taken from this patient. When you look at this liver, we can see a well-circumscribed, heterogeneously hyperechoic mass. When you look at the margins of this mass, we can see some lateral shadowing, which is typical of HCC. This mass measured about 71.4 by 65.8 millimeters. However, we need to remember that more often than not, lesions of HCC are usually hypoechoic. When we look at the surrounding liver parenchyma, we can observe that it has a heterogeneous echo pattern and a coarse echo texture. The liver also generally has an increased echogenicity. These features point to liver cirrhosis. In this particular image, we are probing for the spleen. Here is the outline of the spleen. It measured about 134.4 millimeters in diameter. It is actually enlarged due to portal hypertension. Right next to the spleen, you can see the stomach, which contains air. In this image, we are looking at the vessels of the liver. Right here, we can see the portal vein measuring 12.9 millimeters in diameter. In this patient, the portal vein remained of a normal caliber. Apart from ultrasonography, there are other investigations that are useful in the evaluation of a patient with HCC. We can do ultrasound guided biopsy for histopathology to confirm the diagnosis. We can also do other imaging studies. These are especially useful for staging, for example, CT scan, MRI, among others. We can also do alpha-fetoprotein levels. This is a serum biomarker for HCC and its levels correlate with prognosis. We can also do hepatitis B virus and hepatitis C virus serology, a complete blood count, serum electrolytes, liver function tests, random blood sugar, iron saturation, coagulation studies like prothrombin time. The management of HCC is complex and it requires a multidisciplinary team. Usually the prognosis of HCC is poor since most patients present in advanced stages. The patient will usually benefit from symptomatic management, for example pain management, diuretics to relieve ascites, paracentesis abdominis, among other approaches. If the tumor is in its early stages, surgical resection can be done. Radiofrequency ablation can also be done, or other approaches to ablation, for example the use of ethanol injected directly into the lesion. Transcatheter arterial chemoembolization involves introducing chemotherapeutic agents into vessels feeding the tumor. Brachytherapy is an approach of radiotherapy where the radiation is introduced right next to the tumor. Targeted therapy can also be done with monoclonal antibodies. One can also benefit from systemic chemotherapy. In the event that we have liver failure or after resection, the patient might need a liver transplant. Liver transplantation is considered a definitive management for resectable tumors. If the tumor is not resectable, then the patient will benefit from palliative care. Thank you so much for watching till the end. Please don't forget to like, comment, subscribe, and turn on your notifications. See you in the next video.